Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Hello there, my revered listeners. I cannot thank you enough for keeping your radio dial tuned to WMNF Tampa, the only little community radio station that everyone in Itchy-Coo Park streams, and you too can stream us by just going to WMNF.org. Today is Ask Me Anything Monday. Have you been sitting at home with some medical questions or concerns that are vexing you? Just give us a call at 813-239-9663. Sage is plopped down and comfortable in the control room, just waiting to take your call. So once again, that number to call in is 813-239-9663. You can also send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. You've got another Ask Me Anything Monday for us today, so let's get started. What have you got shaking for us today, Dr. Fred?
Good morning, Bill, and thanks for that intro. Yes, again, a lot is in the air. How was your weekend?
It was pretty quiet, and I've got no complaints about that. Got a little bit of work done around the house and just mellowed a little bit. How about you?
Yeah, actually, it was very quiet, and today is a day for a bit of silent quiet to thank all those service members that gave their lives to fight for democracy. And my appreciation for them is immense. And I wish, though, that today our nation was still fighting for democracy. And I'm sorry that we're losing service members for illegal, crazy, and absolutely useless war. I'm sorry. Moving on, the crazy government continues to do insane things. There's an article I just caught in Newsweek titled "Map Shows Forever Chemicals in Drinking Water as EPA Plans Major Change." Well, the Environmental Polluting Agency has changed its mission from protecting our air and water to making sure it's more polluted. On Monday, the Environmental Polluting Agency announced that it has two new proposals that seek to, as they say, revoke the illegal Biden incursions on job creation and industry. And so what they're going to do is to rescind regulations on 4 types of PFAS, the forever chemicals, because the agency said it was implemented by an unlawful procedure. You know, we're just trying to protect human lives, but it's more important to protect the ability of job polluters and creators to pollute than it is to actually protect the lives of humans on the planet. And then the second, redaction or elimination of rules would be to allow eligible drinking water systems to apply for up to 2 additional years for continuing to poison the people that drink their water. The agency set limits in 2024 for 2 of the chemicals, PFOA and PFOS, and it's not so important to the current government. But it's actually, even Florida's environmental agencies have produced some information. The Florida Department of Health has a piece, you can search for it. It's PFAS General Health information. It's a nice one-pager. And on there it says that you can be exposed by drinking PFAS contaminated water. Well, there's a EWG.org interactive map about PFAS, forever chemicals, in our water. And you can see all of the areas in our country that have it in drinking water and in military bases. Like we know right here in the Tampa Bay area, MacDill Air Force Base is a PFAS poisoned site. And we know that because these forever chemicals are in the foam fire retardants they use on airfields. And so this stuff is everywhere there. And the federal government doesn't really care. It never bothers with actually clean up or care of the people that they poison. You know, all the men and women that served at Camp Lejeune are dying in increased levels of all kinds of horrible cancers. But we know that the health impacts of these things are documented. Increased cholesterol levels, lowered antibody response to some immunizations, reduced inability of the immune system to fight infections, changes in liver enzymes, high blood pressure, preeclampsia in pregnant women, smaller birth weight, decreased fertility. And it's insane, but not the Florida, University of Florida Department, not of medicine, but of veterinary medicine, went out and actually examined many sites in Florida and found that basically most of Florida's freshwater springs from which we derive much drinking water are poisoned with PFAS. And the article in Newsweek actually has a link directly to the interactive map on the Environmental Working Group, and it's just everywhere. It is just everywhere. And so the reason they get into the water supplies, they don't break down, and they just perk down through the system. The most high states are in the South, in northeastern states, and some of the West Coast, places where there are a concentration of Army bases. Armed forces bases tend to have these pollutants. Many experts are absolutely exploding with this idea that we're going to actually stop containing these poison chemicals. It's really crazy because we made some progress, but yeah. It appears that the government's really not caring. And, you know, I just heard this thing. We're talking about this new injectable medication to control cholesterol. Well, toxicity raises cholesterol. It's one of the symptoms. And so we're going to actually create a new chemical to treat the chemical that's causing the chemical problem in your chemical body. Why don't we just get rid of the chemical that's causing the problem so we don't need another chemical to treat the chemical? This is just weirdness. Better living through modern chemistry isn't necessarily the answer here. And so I think we have a lot to think about here, but I would refer you to some of these other places to go look for help because you can actually decrease your toxicity. I'm going to put in the Functional Medicine Florida Facebook page some of these links because I think they're really important. In June, I'm launching a new toxiflammation questionnaire. I'm going to provide this questionnaire for you to figure out just how many toxicity and inflammation symptoms you have so that you may begin to think about how to change some of behaviors so you can eliminate some of these symptoms. And one of the things you can do, I'm not a big fan of bottled water, but getting a water filter, even a simple one, is a first step for cleaning up your toxic water environment because it has shown up in Florida drinking water. I'm going to tell you where. It's on the interactive map. It doesn't appear there's anything directly here on the west coast of Florida right now, but I know that a couple of years ago, EWG found PFAS in one of Sarasota County's wells. So if you want to talk more about toxicity, inflammation, and the rape of our environment by job creators, feel free to call in. But let's talk health today. This is the Healthy Steps Show. I'm Dr. Fred Harvey.
Yes, indeed there. And I do have several callers. I've got Anne Marie and one of our favorites, Gary from Clearwater. But I am going to invite everyone else that's listening to give us a call and listen to the Healthy Steps radio show here with Dr. Fred Harvey here on WMNF Tampa. The number to dial is 813-239-9663. And you can continue to send your emails to dj@wmnf.org. That number, one more time, is 813-239-9663. Let's go to Anne Marie. Good morning, Anne Marie.
Yes, good morning, Dr. Harvey and everybody. Thank you for being there today. I hear your frustration. I feel it. I have questions. I'm going to be a little greedy. I have two. I'm seeing a lot of young people getting cancer, pancreatic, liver, doing 30 rounds of chemo, not touching it. In fact, they're growing. Have you heard of Mr. Tippin, who did dewormer and rid his cancer, and a lot of other people are following suit? And
Yes. I have heard the stories of using antihelminthic medications like ivermectin and mebendazole and fembendazole. And it appears that there may be some interesting effect with these medications. And the actual clinical data that I've seen, not the testimonial stuff where Jim Bob took some pills and my God, he was completely cured. I'm talking about where they actually look at these things in a clinical trial with a group of people and follow all the scientific outcomes. And it seems that maybe fembendazole has some interaction with some chemotherapy to augment the effect of it, but have seen absolutely no clinical data that shows that these things work.
do you feel maybe it is a parasite? And it just
No, I think cancer is a metabolic derangement inside the cell that has absolutely nothing to do with parasites whatsoever.
Right.
And the mechanism of action of like ivermectin, we know that it has an act on blocking the importation of RNA into a cell. Ivermectin blocks a transport protein called importin. It imports the RNA into the nucleus so that then the cell can read it and do the instructions on that piece of computer code, which is basically what RNA is. It's telling the body what to do. And so possibly blocking this intercellular communication methodology is a way of decreasing cancer cells' ability to thrive. I don't know. We don't have a mechanism of action.
Well, they tell people go home, stage 4, close your life up. It would be worth a try, I would think, to do the dewormer. I mean,
Well, I think it may be, but there's another way to look at terminal illness, and that is, why not heal yourself so that you leave the planet whole instead of afraid of death? Because everybody dies. When you have a terminal disease, is it better to poison yourself so that you feel horrible before you die if you know you're terminal? And there's nothing much more that Western medicine has except for really noxious treatments. The use of an antifungal or an antiparasitic or some kind of other thing might actually alleviate some of the symptoms. But if anything makes you feel worse when you're in a terminal state, I'd say stop. Don't bother, because you're going to leave. And you may want to actually put all your affairs together and make peace with life.
Mm-hmm. And your feelings on methylene blue and chemtrails, and I'll leave you with that.
Well, we have things called contrails, and if you notice, they tend to vary based on the humidity and the temperature. And from my perspective, it's water vapor, because that's what happens when you burn hydrocarbons. And chemtrails are a beautiful conspiracy hypothesis. I don't even think it rises to the level of theory. Theory actually has some potential evidence associated with it. And then the other question was
Methylene blue.
methylene blue hype. If it were that good, it's been around for a century. Why is it we're not finding it cures everything? I think Instagrifters are great at selling stuff. That's the bottom line here.
All right, you're the expert. Thank you so much for being there today.
You're so welcome. Now, methylene blue does have methyl groups in it. Methyl groups are great antioxidants, so anytime you can take methylfolate, methyl B12, or if you want to do some methylene blue, I don't really mind it. It's not a harmful thing, but I think most people don't really need to go to that level of external sourcing to feel great.
Do you put it up there with colloidal silver?
Colloidal silver, again, yeah. I mean, there may be some benefit. It probably can decontaminate your nasal mucosa. There's a lot of, testimonial, anecdotal, Class C evidence for colloidal silver. We know that, silver nitrate actually prevents getting, gonorrhea in your eyes when you're an infant. And so, I love that Western medicine doesn't trust a woman to say that she's not been infected, but they still put that silver nitrate in. It's kind of weird. But, silver has effect. We know it has effect, but is it the right effect?
Yeah. Well, I'm a big advocate. Don't eat the animals. You're eating their stress, their death, and I hope that's the way we're all going to go one day.
How's that? Easily in our sleep?
Well, I'm 70 and I haven't eaten an animal in 52 years, and I can run circles around 20-year-olds. But that could be just me. But I really feel we're doing them an injustice, and they go through a lot of torture and stress. And then you eat that besides the hormones and the antibiotics they put in the animals.
I don't disagree with you. Humans consume way too much animal. It's a severe luxury in America. I can't imagine why anybody would ever order a 32-ounce tomahawk steak. I think that's a pure definition of insanity. But I think we can change the way we relate to the environment and all the animals on the planet.
Yeah, it sends out a vibration also. Well, God bless you all, and thank you for all your answers. You're wonderful.
Have a great day, and thank you for calling.
Yeah, thank you very much there, Anne-Marie. Let's go to Gary, one of our regulars. How are you doing there today, Gary?
First of all, how are you guys?
Fantastic, Gary. What's up with you?
You know what? I wear hearing aids, and way too often I get excess wax in my ears. Is there a way I could do it myself to clean my ears, or I don't have to go to a doctor? Can I do
actually, there's a kit you can pick up at most pharmacies, I believe. Murine, the eye drops people, makes an ear care system that has some peroxide drops and a bulb syringe for irrigation. And so, I think you put some stuff in your ears to soften the wax, and then you use some warm soapy water to rinse out your ears gently with a bulb syringe. If that doesn't work, I'd say get to the ears, nose, and throat doctor and have them cleaned out.
Yeah, because you know what? Because when I go to the doctor, all they're putting is warm water in my ear, and I can do that myself.
Yeah, so you can pick up one of those gentle little bulb syringes in that kit and give it a try.
Yeah, I'll do that. And also, the second question I had was, many times you mentioned a functional doctor. Are you a functional doctor?
Yes, that's my specialty, functional medicine.
And what's the difference between functional doctor and doctor?
So the allopathic medicine in which I trained is a specialty that looks for, it describes, it then labels it and blames it for everything. It's a disease-oriented specialty. It is exquisite at describing every iteration of a disease, labeling the disease, blaming the disease for every problem that you have, and then finding a treatment for that. It's too linear for the real world, but it works in some acute care medical situations. And so, yeah, if you have a heart attack, it's probably a good idea to be at an American hospital because you'll get a stent that stops the heart attack. But the long-term care of somebody with heart disease deserves a deeper look than the superficial nature of illness care in Western medicine. Functional medicine was created by Dr. Jeffrey Bland, a brilliant PhD biologic scientist who understood that there was a problem here. This man's brilliant. He was reading 3,000 medical journals a month to create the theories that he came up with that have now panned out to be a real way of looking at the human systems. And the nature of functional medicine is that it doesn't focus on illness. It focuses on the human function. And it looks at the way the human functions and breaks it down into areas of concern, areas of function. So there is a structural system that looks at the integrity of your body. And we might consider that when we're talking about a problem called leaky gut. And then there's the communication system that's hormones, neurotransmitters, and inflammatory communication molecules of the immune system. These things need to be in balance or you're not going to function well. We look at the biotransformation and detoxification systems where the mitochondria make and change molecules in your body. If these things aren't working, then you're in trouble. And we have testing, like the NutriVal from Genova Diagnostics. We can look at behind the scenes how these systems are functioning, communicating, and whether they have adequate resources to run appropriately. If you don't have enough omega-3 fats, your brain is not going to function. And so if you have memory problems, but nobody's checked your omega-3 in the standard doctor, they'll never know that your main memory problem is that you don't eat fish, you don't take fish oil, and you don't have any omega-3s in your body. And that's the difference. We look at how the systems function so that we can make them function optimally. That doesn't mean you're going to have no disease because stuff happens. Genetics happen. There are some things that are really solidly predisposed. We just heard about a cholesterol issue where they're going to do this injectable thing that brings down your cholesterol. Well, what if you could actually just look at where the deficits were in your body and fix the cholesterol without having to take an injectable medication? That's functional medicine.
Wow. What an answer. Thank you.
You're so welcome, Gary. Glad to give you the good information because it helps to have people understand the distinction between what I used to practice and why I don't do primary care medicine anymore and what I practice now, which is helping people with chronic illness recover, because that's not the specialty of primary care. It's maintaining your chronic illness. Functional medicine is about eliminating your chronic illness.
All right, Jack. Thanks a lot. And talk to you next time.
Okay, Gary. Thanks for your call. Always appreciate talking with you.
Okay, bye.
Yeah, it's always good to have you kind of sit in the studio there, Gary. I do have Howard waiting in the queue, but I want to remind folks that you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, and I'm inviting you to participate in approaching your medical questions or concerns by dialing 813-239-9663. I do have Sage in the control room answering the phones this morning, so that number to dial is 813-239-9663, and you can continue to send your emails to dj@wmnf.org. Good morning to you, Howard.
Hey, good morning. Happy Memorial Day.
Happy Memorial Day.
Yeah, thanks for doing live shows today. I appreciate it. I usually listen to the archives, so if I'm not working, I thought I'd give you a quick call. That October last year, I got diagnosed with polymyalgia rheumatica, which I'm sure you've heard the term.
Yes.
But it's one of those things I've discovered after much trial and error that it is triggered in me by typically sodium-based preservatives, sodium phosphate, sodium pyrophosphate, sodium lactate, erythorbate, sodium nitrite, especially ham and bacon cured things, but also pickles, some fruit juice products and frozen things have, like frozen French fries, very often have preservatives added to them. So I found that if I eliminate those from my diet, then the symptoms and much of the acute pain goes away.
That's excellent. That is exactly the approach functional medicine uses. We look for what your triggers are, take extensive history, and go deep so you can figure out what it is you need to eliminate, because polymyalgia rheumatica is the least defined of all the rheumatic autoimmune inflammatory illnesses. It shows up as generic inflammation. You hurt like heck. Your muscles feel like they're on fire. But no one can give you an answer other than, oh, here's some prednisone.
Right. Yeah.
And that's just not adequate.
Yeah, I decided that, I'm not taking prednisone for 2 years. In fact, I stopped prednisone after about 6 or 8 weeks. I don't need it now.
Excellent.
But I wonder if you had any other thoughts or suggestions on what might possibly be triggering that, because it's part of your digestive system issues. Now, if you can't digest preserved foods, either the digestive system is working below capacity, or there's something that you're missing that's causing that shortfall in the ability to digest those foods.
So food triggers are definitely a possibility. I've seen people trigger with dairy, with pasteurized dairy, with grains, but no, it's not consistent. It's not the same thing for everybody. But since you're feeling good, it may be worth it to take a look at some other things, like what is the omega-3 level in your body. If your omega-3 level's low, you have high omega-6s versus omega-3s, and maybe lots of arachidonic acid, which is a pro-inflammatory fat, you may have reason to go down that pathway increased. So if you have the ability to do that, like Quest offers an omega index. If you're below 8, I'd say you're too low. You could see a functional medicine doctor and get a full functional workup. But it sounds like you're already on your functional path out of PMR. So I would keep doing what you're doing, and then maybe look at some of these other things that your regular doctor could do, like get a Quest Omega level. Make sure your B12 and folate levels are good. And then if you want, go check for food sensitivities. There are certain better labs that do better jobs. But in general, an IgA food sensitivity is interchangeable at most places. Some do a better job. I like some that actually look at the something called C3D, which is a complement factor. When they look at C3D and show that that's reactive, that tells us you're getting actually some cell damage. So it helps to have a functional practitioner direct you to which lab to go to. But I think you're on the right path, sir.
Yeah, interesting. And also something like sesame oil, which is extremely non-oxidative. It has an extremely long shelf life, doesn't go rancid. I can't digest that. That causes a trigger too.
Ah, that's interesting. So you may have some food sensitivities you need to look into.
Yeah, okay. All right, so C3D, and I'll check with the doctor and see if they can get me a lab around here. All right.
Best wishes.
Thank you again.
Hope you feel better.
And enjoy the show as always. Thank you.
Thank you.
Thank you, Howard. Thanks for listening, and thanks for calling on in. I've got Tom in Tampa, and Mark just checked on in. So let's go to Tom in Tampa. Good morning, Tom.
Good morning. About a month ago, I had a spot on my nose, and my dermatologist gave me mupirocin ointment, 2%, and I put that on there for a week, and then she said, come on back, and took a look, and said, well, it looks like there's a precancerous, that spot is precancerous. So she gave me fluorouracil, 5%. And my question is, how in the world is this cream going to take care of the problem?
Well, 5-fluorouracil is chemotherapy. You're actually doing cancer chemotherapy there. It actually interferes with cell division, so you have a rapidly dividing cellular problem, which is probably an actinic keratosis. And when you put 5-FU on it, it actually kills those cells that are dividing quickly.
Okay. Well, I just stopped. I had to do it twice a day for 2 weeks. I just stopped, and it's another month before I go see my dermatologist again.
Well, did the nose turn red and did the skin slough off?
Well, absolutely. It's there's about a dime-sized red spot all around where the precancerous spot is, and yeah, it's very red, and it's I got to avoid the sun, but I mean, it's only been 2 days since I stopped, so it looks a little better, but
it's going to take a couple of weeks for that to heal, but the work has probably been done. It's the precancer has probably been killed. That's why the area is red, because it's also killing some of the normal cells around the area and causing inflammation.
Right. Okay. Well, initially she said we can do a biopsy or we can do a cream, and I said, well, tell me what you would do, and she said, let's go with the cream. So, is that the better choice?
I think it's an adequate choice. You'll see what's happening next. If it's not there and you have nice, smooth skin afterwards, then you got it.
Right. Okay. Thanks for your time, Doctor.
You're welcome.
Thank you there, Tom. Let's go to Mark in Hudson, and I've got Margaret just checking on. And good morning to you there, Mark.
Hey, how are you, Doctor?
Excellent, Mark. How are you?
I'm good. I have a friend of mine, and we started on keto. He was really high. His A1C was like in the 9s, and we got that down to 6. All his sugar levels are down, but his PSA went up. Is there any relation to keto and maybe the prostate getting larger or inflamed or something of that sort that might cause those PSA levels to go up?
Well, saturated fat actually causes inflammation, and if he's been doing a lot of red meat, cheese, and that kind of stuff to stay keto, then yeah, he's probably got some inflammatory fat on board. And also, if it's not organic meat and cheese, there's probably hormones in it that produce some effect. But it sounds to me like he has an underlying prostate problem, and it was revealed by the diet.
Okay. His last level 3 months ago was 1.5, and it's 4.5, 4.7, something like that now.
Well, that's what we call vectoring, going straight up. Normally, you'll see a prostate number go from 1 to 1.2 to 1.4 to 1.6 as a person's prostate grows in age. But when you go from 1.5 to 4.5 in a months-long period, that means you have something active there, either a prostatitis or an active tumor.
Correct. Yeah. Okay. Well, I told him he probably needs to see a urologist.
He at least needs to go to his primary care doctor and ask for a free PSA test.
Well, that's what he just had. He had his PSA. It went up to
free PSA. Free PSA actually looks at other parts of it, and then it lets you know what your actual risk for cancer is. Straight up PSA with a vector suggests cancer or prostatitis, but the free PSA can give you more information about whether or not it's actually cancer or inflammation.
Awesome. Great information. Thank you, Doctor.
You're very welcome.
Have a great day. Happy
You too.
Day, guys. Bye.
Thank you there, Mark, and best wishes to your friend. I do have Margaret from Sarasota in the queue, but she's all alone, and I want to invite you to participate in the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Just give us a call at 813-239-9663. Again, that number is 813-239-9663. Good morning to you, Margaret. What have you got for us today?
Good morning. I'm wondering about the microplastics in our water supply, as you were discussing earlier. And I heard or read somewhere, well, first of all, I use a countertop pitcher to filter my water. And then I read or heard somewhere that steaming the water or boiling the water can make a difference. And I didn't know if that one is true, two, if that's like on an industrial level, or if I boil my water before I filter it, is that helping, or am I wasting my time?
So boiling and distillation are two different things. Boiling will actually remove some of the water from your pan and leave all the toxins in the pan. Whereas if you distill the water boils off, goes to another container and is collected, and the poison's left in the pan. So boiling won't help. It'll just concentrate the toxins. The pitcher does get rid of microplastics, but it doesn't get rid of lead. Oh, a little bit of lead. It doesn't get rid of fluorine and PFAS, though. The PFAS, many times, though, are attached to the microplastic. And so it does help to get your water filtered in any way. But the approach that I use, I'm not really, they're getting better. I'm not convinced yet that reverse osmosis is the way to go, except on an industrial level. I don't like them in the house because you waste about a gallon of drinking water for every gallon you get out of the reverse osmosis. And your thing has to fill up, your bladder. You have to have enough pressure to get things going. I like a 3-part carbon block resin fiber carbon block filter. I get mine from a company called Atla, ATLA. And they have evidence that the resin filter gets a lot of fluoride and a lot of PFAS. Nothing is perfect. But the double carbon on either side gets the rest of the junk out. There's a 5 micron on one side and a 0.5 micron on the other side. So you get really clean water, and you only have to change it about every 6 months unless you're really high volume.
Okay. Wonderful. Thank you very much. I appreciate that.
You're very welcome.
Goodbye.
Bye-bye.
Thank you very much there, Margaret. And I do have a caller. I believe the name is Squash, but I'm going to invite people to, again, participate in the Healthy Steps radio show. There's only about 20 more minutes left in the show, and I do have Sage answering the phones with due diligence. And you're invited to participate by calling 813-239-9663. Again, the number to call is 813-239-9663. Good morning to you.
Good morning.
Hello there.
Good morning.
What do you have for us today?
Well, my name is Skosh.
Skosh. Very good. How do you spell that?
Skosh.
Cool. So, Mr. Skosh, what do you have for us?
Well, I heard you talking to a woman about her ears and earwax. Both my wife and I, on occasion, feel like our ears are plugged. I'm reasonably sure it's not earwax in the outer ear. I was just wondering if there could be a problem or an issue with the middle or inner ear. It seems most prevalent for me when I'm sweating or out in the sun and working out in the yard and sweating a bit.
That's an interesting way to get it, but it sounds like you might have some intermittent blocking of your eustachian tube, the tube that normalizes the pressure from the middle ear into your sinus. And, that can get blocked from pollen. So maybe you're outside working and you're actually getting exposed to stuff that would cause your nasal mucosa to swell and then cause that dysfunction.
Okay. Yeah, that sounds reasonable.
And if you and your wife both get it, maybe you're being exposed to the same particulates.
Yeah, it doesn't seem to happen at the same time, but I suppose,
Okay.
we're not out in the yard at the same time either.
Well, that makes sense then. Yeah. So it could be that it is the same thing. It could be you have different sensitivities. But it does, if you don't really think that it's wax, and the way you describe it doesn't sound like it is, that it probably is a simple eustachian tube dysfunction. And maybe using a neti pot could help. Some stinging nettles and quercetin can calm down reactivity.
Well, yeah, I was wondering if a decongestant or antihistamine. I have not tried, but
yeah. So stinging nettles leaf is a natural antihistamine. Quercetin is a natural product that stabilizes mast cells, so you have less reactivity. And then you could go to a decongestant. I like an herbal decongestant called Bion, which is Biyan. PIAN, and it's very effective without doing the jitteriness that Sudafed causes. And those are my go-tos for this kind of symptom.
Okay, I'm familiar with the nettles. Would you spell that Bay? How did you say it? Quercetin.
Oh. You might even find nettles and quercetin in a combination product at the health food store or at the pharmacy. It's common together. Oh, and then the other one is Biyanpian. That's the decongestant.
Okay. Mm-hmm. Cool.
So I hope that helped you, Skosh.
Yeah. I'll keep you posted.
All right. Have a great day.
Thank you. You too. Enjoy your Memorial Day.
Thank you.
All right. I've got Fernandez in Tampa. Good morning to you, Fernandez.
Hello.
Hi.
Dr. Harvey. I talked to you last week about getting the hot laser treatment for my shoulder.
Yes.
And it really worked. I had like 4 treatments.
I'm so glad.
It really worked.
I find it highly effective.
A chiropractor in Ybor City, and he's done a good job. But I have some other issues. I have a rheumatologist who now put me on gabapentin, methotrexate, folic acid, prednisone, and I don't want to take those. I just don't want to. But my hands I'm in a lot of pain with my hands now.
Well, so gabapentin just dulls your brain to think it doesn't have pain. It doesn't treat anything except for seizures. So that's one you probably don't need, but I'm not going to tell you not to take it. I think that's one to discuss with the doctor that gave it to you. But the other 3 are disease-modifying agents, so you may feel less pain using them. And you may not need the gabapentin. And that's why I would have a discussion with the doctor. If you can put up with pain while you're waiting for the other medications to take effect, you may not even need the gabapentin to do that.
Okay. Now, I read that methotrexate is really like a cancer drug.
It is an anti-rheumatologic drug. It helps to reduce inflammation, and it's also used for psoriasis. It's also used for cancer.
Okay. So that's once a week. So you think it will be helpful? Because I just started.
It may be, but you know what else would be helpful is finding a functional medicine doctor and getting a functional workup so you can find out why it is you have this inflammation they're giving you toxic poisons for. They work. They work. I'm not saying you shouldn't take them, but you're using what are known poisons to help your underlying situation. So maybe we can find some reason for that and find a natural solution.
Okay, because I never had anything wrong before, and I eat really good and exercise. So
what triggered this? That's the question. You got to have somebody asking the right questions to find out what is the trigger. Why do you have this? Rheumatologists just say, "Oh, you have this. Here's a pill." Yeah. Remember, when you go to any Western medical specialist, it's name it, blame it, tame it. We named your illness. We're blaming it for everything you've gotten. Here's the pile of pills you got to take for the rest of your life to recover.
And I don't want to do that. So that's
right.
I'm calling you because I figured So I'll find someone in Tampa then. I wish I could.
ifm.org. Do the physician search for your area.
Okay, the functional medicine. Okay.
Yep.
Thank you. You were just wonderful. Thank you so much.
You're very welcome, Fernandez. Good luck with that. Hope you feel better.
Bye.
Thank you very much there. And yes, I've got Doran on the line. Good morning, Doran.
Hello.
Hi. What have you got for us, Doran?
Well, I'm in a rehab facility for my weakness in my legs, but I was I was sitting on the toilet, and I was constipated, and I was straining, and I passed out. I fell off the toilet, and I hit my head.
Oh, darn.
On my head. And I pulled when I did lose consciousness, I pushed the help button, and they came and found me, and they put ice on my head. But so 2 days later, I'm standing at the sink shaving, and I'm getting weak and dizzy, and I had to hold on to the sink to keep from falling. And I'm wondering if I should be concerned.
Yeah, I think it's worth it for you to get an evaluation of your blood pressure.
My blood pressure is low.
Yeah, I think you should get it evaluated by your doctor, though, laying flat, and then standing, and see if there's a change. Are you on blood pressure medication?
Yes.
So that needs to be reevaluated. If you're passing out and your blood pressure is low, you probably need a reevaluation of the medication because they are probably responsible.
Okay. Yeah, because my blood pressure has been under control, 118, over 80 or 90, consistently. It's just after this fall, they now have my feet elevated, and they took my blood pressure and it was low. So,
yes.
Or not my fall, by my dizziness. So I was just concerned about that dizziness, whether 2 days after a fall, there's anything else I should do.
Yeah, get your blood pressure evaluated. See the doctor.
Okay. See the doc.
Yeah, they need to reevaluate and ask them to do the lying down and standing up blood pressure so you can see the difference. I think that's really important. Most don't take the time to do that.
Okay. All right. Sounds great advice. Thank you.
You're welcome. Have a great day and good luck with that.
Yeah. Thank you. Bye-bye.
All right. Thank you very much there, Doran. I've got Lorraine. Good morning to you, Lorraine.
Hi, doctor.
Hello.
I have asthma, and I've had asthma for 30 years now. And my doctor, she realized that I didn't want to use the little inhalers with the propellants in them, so she's given me my own nebulizer and a Buterol. So I try to take a treatment once a day. But with the increased wildfires and going on in Florida and smoke being one of my triggers, I worry about having to take the prednisone, a dreaded drug, but it helps me quite a bit, and also increasing my breathing treatment. Now, I was wondering if you could recommend some supplements that I could take in addition to my asthma treatment that would help me with my breathing.
I think a couple of questions first. Do you have a HEPA filter at your home?
Oh yeah, I've got I've got a filtration, all that good stuff, and that I'm not sure if it makes it worse when I leave the house because then I go outside and of course the air quality isn't great. And
yes. Do you wear a mask when you go out at all to help with particulate?
Well, I've quit doing that since the COVID thing. Back when the COVID thing was happening, I actually got COVID after I had the vaccine, but I had a mild case, and it was only a week. And strangely enough, the worst thing for me is the smoke in the air.
So the thing to consider for people who have chronic asthma is the use of inhaled steroids. And that may be your answer here. If you don't want to use something with propellant, they do make the kind that are in the encapsulated powdered form. So when you do a puff on it, you're actually opening up a capsule and breathing the powder, which is micronized, down into your lungs. And daily use of a steroid inhaler has been shown to really be helpful so that people don't have to take oral prednisone.
Oh, there was one that my pulmonologist gave me that started with a B. I can't think of the name.
Budesonide.
Right now, it was.
It's called budesonide.
Yeah, and
yeah.
I took that for a while. No,
good. I'd go back to it if you're having trouble now.
Yeah, that's a good idea. I'll mention that to my my primary doctor and see what.
Yeah, I think that would be a really good thing because the evidence is in. If you increase your albuterol, you increase your risk. If you use the inhaled steroids, you don't get as nearly as much steroid effect as prednisone would do, and it also reduces your risk from using too many albuterol inhalers because more of that can induce heart attacks and things like that.
Right. Well, I stay away from those little rescue inhalers. I have one I keep in my purse, but I'd only use it if I was like in a store or something. And it was.
But you have albuterol in a nebulizer, which is the same thing.
Yeah. Yeah, but there's no propellant in that. It's just through.
I'm not worried about the propellant. That's not the issue. It's actually the albuterol use that is the issue. Using your little propellant things are completely irrelevant to me when it comes to the risk you have from using an albuterol nebulizer and increasing the frequency of that versus adding an inhaled steroid, which reduces all of your symptoms.
Okay, so an inhaled steroid is the way to go then.
That would be my first choice. And if you look at the algorithm online for step care in asthma, it's right up at the top.
Okay.
All right.
Have you got any websites that you could direct me to that might help?
The American Lung Association.
Okay.
They will tell you all the stuff on asthma. You go to the CDC for asthma as well. And you can also just Google step care for asthma, and you'll get a list of the things to use.
That was Step Care, STEP.
Take steps towards your health, like I tell you every day.
Okay. All right. Well, thank you, Dr. Harvey.
You're so welcome. Have a great day. I'm going to move over to a couple of quick emails, the ones that are on phone that I can't actually respond to. Other than on air. So benefits of niacin. Niacin is a great medication, or not medication, it is. When you get a time-release niacin, it can be great for cholesterol. But niacin, the question this person is asking, they want to know if it's helpful in preventing skin cancer. And yes, it is. So getting some niacin on a daily basis is not a bad idea. Now, they suggest niacinamide from dermatologists and doing 500 milligrams twice a day, and it's for non-melanoma and precancerous actinic keratosis, like the man with the nose lesion. It can be very helpful, but the actual niacin itself helps the cholesterol. This one also, I appreciate the PFAS discussion, but the statement that Florida gets drinking water from springs is incorrect. Virtually no from springs. 90% is from the Floridan aquifer. That's very good information, but the Floridan aquifer actually supplies the springs, and so do the other aquifers. And so that's part of the problem here, is that we have drinking water contaminated, the springs are contaminated. Basically, our state and all of the United States is contaminated with forever chemicals, and that's the problem. We need to rein in the job polluters, the creators of this mess, and make them pay for it, because they're not paying for the damage they're doing. They're getting away with murder. See you next week.
Thank you again, Dr. Harvey, for another illuminating and beneficial Healthy Steps radio show. And to you out there, I want to thank you and all of our participants, listeners, and supporters. You make this show awesome. Sage, a huge thanks goes out to you for answering the phones and all that behind-the-scenes stuff. This show would not be possible without your assistance. Of course, you've been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR news, and then get ready for the Sustainable Living Show hosted today by John Butts. Until next Monday at 10 a.m., thank you for listening and supporting the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community-conscious radio station. Stay safe, stay thoughtful, and know that you are loved.